Good day, everyone. It's International World Lymphoedema Day today, and this is amazing. So have a look at the news tonight, and you'll see buildings lit up around Australia, around Adelaide, and around the world in blue for Lymphoedema Day. I was going to wear my lymphedema shirt, which is blue, and I thought that's probably not going to look quite so good on a day when we should all be pink. But anyway, and my granddaughter did go and see Pink, apparently. It's pretty good. All right, so welcome and thank you for coming. I'm sorry, I can't see some of you people around there. Hi. I've got 40 minutes, is that correct? Someone's going to give me a 10-minute warning. You need to with me because I just keep on talking. Okay, so today is about understanding the lymphatic system, your lymphedema risk, and what you can do to make a difference and live well if you've got it. Okay, and I've got some books with me that are freebies. You can have them if you want them, but it's best to have them when you've spoken to a health professional about it. I've also got a wonderful new book by Andrea Pluck about Swollen with a Swagger, embracing life and living with lymphedema, if you're interested in that sort of thing. But what I want to do is make you feel comfortable with understanding the lymphatic system and understanding that you can manage lymphedema well. You can manage the risk of getting lymphedema, you can manage lymphedema and a whole lot of different things. Now, let's start off by looking at our lymphatic system. It's low pressure, not like blood pressure. Who knows what their blood pressure is right now if you've got normal blood pressure? Have a go, yep. 110 over 80, yeah, that's pretty good. 120 over 80 maybe. But our lymphatic pressures are nowhere near that. In fact, they might be 5 or 10 or 20 millimetres of mercury, maybe up to 50 maximum. So it's a low pressure system. Small volume, 4 to 6 litres per day, drain back into the veins. And when I say drain back into the veins, that's the veins that are in our lymph nodes and the veins that are up here at the exit point, the jugular subclavian. So there's two places where lymph drains. Small volume, not much. Slow flow and slow acting, that's about our lymphatic system. Because our little lymphatics are only pumping about 4 to 6 times per minute. Can you imagine that? Just going like this. Woof. Opening up again. Woof. Really slow. So the message there when you're thinking and dealing with the lymphatic system, no hurry, be relaxed. But our lymphatic system is absolutely essential for a good immune response, okay? And it's essential for the health of your cells and the tissues. And that's what we want to do. We want to make sure your cells are the healthiest they can be and the tissue is the healthiest that it can ever be. And, you know, in part of it, that's why after you've had chemotherapy and those sort of things, the recommendations are now more towards getting out there and exercising and doing things, okay, to actually spread all the chemotherapeutic agents around and to stop them being concentrated, but also get that lymphatic system working better so you can get a better response. So the lymphatic system also, the last thing is it's responsible for controlling swelling, and that's what it's about. And we can make our lymphatic system work so much better than what it might be working currently if you're sitting there. Like one of the things you should never do with the lymphatic system is cross your legs, because that's not good for the lymphatic system drainage of your legs. Okay? And I've got a little machine down in my little black bag there. I can show you how bad it is if you cross your legs. Okay? So just if you cross them again, I'm going to be down there with my little checking you out. Okay, so let's consider a normal arm, your arms as they are. The amount of lymph leaving it is about 100 mils per day. 100 mils. Do you know what 100 mils is? It's 4 tablespoonfuls. Okay, have a look in a glass of water, which they haven't given me today. But have a look in a glass of water, 250 mils a glass of water. But, you know, my little glass down the front there has probably got 100 mils in it. Just a little bit of fluid. That's a whole day's drainage. 5 mils per hour. Okay, and of course, if you've got an infection or if you've got a wound or poor cuticle care or whatever, that volume might double up to 10 mils per hour. Okay, but 5 mils per hour, and that's what can make a difference. 5 mils, half a teaspoonful per hour. If you can get more of that fluid clearing out, or if that fluid accumulates, You know, that's the difference between your arm swelling and your arm not swelling. 5 mils, it's not much. And we'll give you some ideas about how to do it. Okay, why we have to pay attention to the lymphatic system? It's a sewer, it must flow, okay? It takes away all of our waste products from our cells, all of the things we don't want in the body to be hanging around. And then one of the most important ones is called inflammatory mediators. They're called cytokines and lymphokines. If they sit around in the tissue in high concentrations, they cause inflammation. And you know what inflammation does? Come on, have a go. If you've got an inflamed area or a tissue, what happens? It swells. And what about its colour? It's red, okay? And, you know, if you can help the lymphatic system work better, that inflammatory response will be reduced and may not even occur, okay? So good lymph flow is needed for cell health. Slow lymph flow also means more fat deposits, okay? Because in your lymph, there's factors called adipogenic factors, which when they sit around the tissue, they say to your little fat cells, hold on to the fat, deposit more fat, more fat, more fat, okay? And that's the middle stage of lymphedema. Early stage lymphedema is fluidy, middle stage is fatty, fluidy, and end stage is fibrosy and tough. But there's all sorts of things we can do to stop the development of lymphedema and stop its progression, and that's what it's about today. The other thing is that reduced lymph flow can mean more infections. Okay, so if we can get the lymph system working better, our body defences work better. That means our little macrophages, our mononuclear phagocytes, come out in the tissues, if the lymphatic system's working, and grab hold of the bacteria, digest them, and kill them before they can proliferate. Okay, so super, super important. So immune responses are poor when lymph flow is poor. Now let's have a look at the overview of our lymphatic system. Oops. It's not working. Okay. Someone got control over the movie? Yep, got it. Well done. Hit it twice. Actually, that was 3 times I slugged it, but anyway. All right, have a look here. Can you see the arm? See the lymph coming out of the arm, of that arm, and see the lymph coming out of the legs? So, you know, from down here, from in this area down here, the lymph has got to come all the way out through your knee, through your thigh, through your tummy, through your chest, and drain up here. For the arms, it's a little bit simple. It comes here and drains into there, or from this arm comes here and drains into that side of the body. So when we're thinking about the lymphatic system, we've got to think holistically. And if there's one word you take out of today's session, it's holistic care, okay, of the lymphatic system. Now, why that big picture? Why did I show that? Is, well, you know, you can't put water in a bucket full of water. I can't put water in my glass if it's got water in it, okay? I've got to empty it out first, and that's the secret thing. In terms of the lymphatic system, we've always got to create a space for the lymph to go, okay? And that space for the lymph to go, if it's our arms, is going to be this area up here, okay? And that's the most important thing. So what do you think makes the difference? What can clear the fluids out of this chest? Who knows what can clear fluids out of our chest? What do we need to do? Exercise, activity, exercise. And we'll talk about yoga, tai chi, qigong, breathing. Simple thing like breathing can make a big difference. And what are you doing when you're sitting here right now? You're breathing, but I know that because you're all still kicking around. But you're not breathing deeply, are you? You're breathing very shallow. Like when you're sitting there on your computer desk, you know, you're sitting there on your computer desk, you're not breathing much. You're just doing a little bit. And when you're doing that, all that time you're doing it, lymph is accumulating in your arms, in your legs, in your tummy, in your chest. But the moment we take a nice deep breath or do something like this and have a big stretch, don't you feel better? And you feel better because you've got your lymphatic system working better. So that's the most important message here. That's what our therapies attempt to do. That's what you, your partners and carers are going to be doing. Emptying out the buckets, creating a space for the lymph to go into and get away. So the general parts of the lymphatic system are called lymphatic territories. It's like the states, Victoria, South Australia, Northern Territory, etc. And we've got the state borders, haven't we? Okay? So that's what the lymphatic system's like in our arms, in our bodies. Between them, the state border is called a state border, and in the lymphatic system, it's called a watershed, okay? Lymph will go that way if it's on that side of the watershed, and it'll come this way if it's on another side, and it'll take a different lymphatic pathway. And here's something you can see here is the lymphatic territories of the arm. Have a look at this, and you can see what's going on there. And which one's the... is there one here for a pointer? Not really, so I've got a point. There's not. It's coming from behind, is it? Yeah. Okay, no sweat. Okay, as you can see here, lymphatic territories in the upper arm, lymphatic territories in the lower arm. Roughly three. We haven't all got it exactly like that. So what we've got to do is just remember, one part of the lymphatic system might be blocked, the other part might be draining well. And if we know there's a draining area, you can throw it up here if you want. Oh, speaker. Yeah. Okay, so I can wander around, you can hear me better then. Yeah. Okay, that's good. So everyone's lymphatic system is different. The places where you may have a swelling may be different, okay? And you need to remember that, but we can show you about how to think about that and how to fix those sort of things later on. The organisation of the lymphatic system, here's your skin up here, here's your muscles down here. What I'd like you to do is just pick up a little bit of your skin like that, between your thumb and forefinger, wherever you like. And what you're doing is picking up this bit there. And that bit there is where lymphedema occurs. It's called epifascial. It's above your muscles. And you might notice a slight difference between one part of the arm and another part of the arm. And that's quite normal, depending on arm dominance. But if there's a little bit extra fluid and fat and fibre and stuff going on in there, it might be thicker, okay, than some other part. So that's where lymphedema is. That's what it's all about. But this one would have showed you the function of the lymphatic system. What I'd like you to do is just run your hand over your arm like this, okay, always upwards, never downwards, okay. Remember, you want to drain it towards this area. And as you moved your hand along, that would have opened and closed these little junctions here, okay, and allowed the fluid to go from the tissues into our lymphatic vessels and then taken away. And you know what? The more you put in the lymphatic system, the harder it works, the more it pumps. Because, you know, if you stretch a muscle, what happens next? The muscle contracts. And with the lymphatic system, that's what we've got to do. We've got to get the fluids and the materials into the lymphatics, because once it's in there, stretch, contract, okay? So that's the whole idea of treatment. It's the whole idea of exercise and activity and all those sort of things. It's the idea behind massage and these sort of things, that you get the fluid into the lymphatics and it will be taken away better. So this movie will put it all in perspective, but again, it's unfortunately not working well. So what this was going to show you is the whole picture of the lymphatic system and how it's working. So we'll go for other things in a minute. Okay, let's look for leverage. Leverage is where your leverage points are, obviously. They're the things that can make a difference. So every one of these things that I'm showing now is going to help you make a difference, okay? Number one, think about load on our lymphatic system, right? Very important. Blood capillary pressure. What do you think is going to influence blood capillary pressure? Blood pressure, yeah. So if you're hypertensive or you're getting upset about your grandkids or someone else like that, or someone just ran you off the road, your blood pressure is going to be high. The load on the lymphatic system is going to be higher. So, get those sort of things managed. Know that they're going to have an impact. The other thing, who's noticed as you get a little bit older, you bruise easier, okay? That's blood capillary leakiness. So, if there's too much bruising, too much blood vessel leakiness, there's more load on our lymphatic system, okay? More stuff to be taken away. So we've got to make sure it's working as good as it possibly can. The other thing is big molecules in the tissues. If there's lots of big molecules in the tissues because of blood vessel leakiness or something else gone wrong, then that's going to attract lots of small molecules. Do you know one big molecule of protein can attract about 2 million molecules of water? So can you see how important it is to get rid of the protein in the tissues, carry it away, massage it away, and then the fluid will go away. So it's a pretty intensive cycle of things, but get rid of the proteins and the fluids will move. Number of active capillaries. So if I do this, like this, right now, my active capillaries are increasing. And if I stop dead, like that, I not mean dead. But, you know, if I stop quickly, right now there's lots of fluid leaking out of my capillaries into my tissues. There's more of a load on our lymphatic system. But if I do this and then I slow down gradually, like this, that's the best, because that means I'm helping drain the lymphatic system. If you saw the movies, you would see doing this helps load the lymphatic system and takes the fluid, the protein away. So if you do exercise or activity, warm down or cool down slowly. Super, super important, always. Now, the next thing which determines lymph load, fats in your diet. Long-chain fatty acids sometimes are bad news for you. Talk to your dietitian about that. That might be a basis of another talk. Some medications cause an increase in lymph load. See, calcium channel blockers, for instance, can cause an increase in lymph load. Therefore, doing some things by tweaking your medications can make a difference to lymph load. So is everyone clear about all those sort of things? You can manage the load on the lymphatic system by doing simple things, by taking care of yourself, by looking at blood pressure. Okay, super important. Then, the next thing, what determines flow out of the lymphatic system? Well, the load. The more that goes into it, the quicker and stronger it will flow. But you've got to get that fluid into the tissues, from the tissues into the lymphatics. Okay? That's super, super important. So, next thing which determines lymph flow, rhythmicity of the lymph collectors, activity of nearby skeletal muscles. Do this, you're really helping the lymphatic system to load and to flow, okay? Movement is very, very important. The next one is variation in chest and tummy pressures. Take a deep breath in, just right now, go, breathe in. Nice and slow over 4 or 5 seconds, hold it a couple of seconds, breathe out. That's called diaphragmatic breathing, and during that time, you've changed the pressure here in your tummy and in your chest. And by doing that, you've emptied the fluid out of your lymphatics in your chest area. It's gone up to here. And when this is emptied out of here, this bucket's emptied, what happens is the fluid from your tummy area here then can move up here and can be taken away and put back into our blood vessels again. So have another deep breath. Okay, nice and slow. And that is wonderful for lymphatics. If we had time, we would do a demonstration of moving your arms out like this as well at the same time. And as you open up your arms, you squeeze your muscles really tight. As you squeeze your muscles tight, what happens? You squeeze the fluid out of the arms, comes into here, and then goes back into your blood vessels again. So it's emptying the buckets is important. Pressures exerted by surrounding structures will influence lymph flow. Pressure by applied compression will be also influencing. And that's applied compression is part of the way in which you manage a lymphedema, really important. Let's have a look at some reasons why lymphedema occurs. Well, sometimes lymph vessels or collectors are removed because of surgery. Sometimes they're damaged or constrained by fibrous tissues associated by radiation. You have to have radiotherapy. Sometimes there's an underlying genetic issue, and that's really important. We just don't have enough lymphatic vessels. It's not the radiation oncologist's, the oncologist's fault or anyone's fault or your fault. It's genetic, and we have to just understand that and deal with it. And the genetic ones, there's not enough lymph vessels or collectors, or some of us have low pump pressures. You know, I said the lymphatic system pressure is really low. Some of us have got systems that are only maybe able to pump up to 10 or 20 millimetres of mercury. Some of us have got systems that can pump up to 60 millimetres of mercury. And if we happen to have one of the high pump pressures, it's good. But you know, to get your lymphatic system to work better, you've got to get the stuff into it. Because the more you stretch your lymphatic muscle, the harder it pumps. Just remember that all the time. Load the lymphatics, and then it'll do a better job. Okay. No, I don't think these movers are going to work then either. Boy, one might, no? It looked like it was going to work, didn't it? Oh, there's one. How'd you be? That's what surgery's done. You can see that. And you can see what happens immediately. They've cut a lymph vessel, and see all the lymph goes via another pathway, a lymph collector, another pathway, drains away, and that's what we hope is going to occur. And if we had radiotherapy, No. Don't worry. Not going to work. Try it once more. Now, this is just going to show you, if you have radiotherapy, what happens is there's a build-up of fibre in the tissues, and as fibre builds up in the tissues here, it stops these lymphatic vessels from being able to pulsate, which you would have seen in the movie, okay? So the really important thing is radiotherapy does that, but you know, we can soften, we can break up the radiotherapy, massage can do that, laser and all those sort of things can do it, but let's not worry too much about it. But two things, surgery and radiotherapy do impact on the lymphatic system. So here's where lymphedema occurs. Like we said before, it's a superficial problem. Here it is out here in this area above the muscle, okay? And so what that means is, yeah, it's easily observable by everyone, but it also means that it's moderately easily treatable as well, which is what we've got to do. And that's a very important factor. Now, I want you to remember not everyone's going to develop lymphedema. It's about 20% in those who have had quite a lot of lymph nodes removed from their axilla and who have had radiotherapy. And it's in about 3% of those who have had a few lymph nodes removed, okay? Axillary sampling, you've probably heard those sort of names. So the risk is not real great, but what we've got to do is understand the risk factors and then looking at those risk factors and saying, which one of those can I or my therapist or my professional help me modify to reduce the risk of lymphedema? Because we come back to it, how many mils of lymph fluid is there per day? 100 per hour, 5 mils. Okay, and let's just think about that for a minute. If I allow 5 mils extra fluid to stay in my arm for a day, do I know it's there? Half a teaspoon? No way. 5 mils for a week? 35 mils. That's 2 tablespoonfuls sitting around in my arm, my legs, my arm, my fingers. Do I know there's that there? Maybe. What about for a month? 35 mils per week? For a month, 140 mils. Yeah, that's subclinical lymphedema. So that's something that we need to think about and start managing. But you know what it boils down to? That. 5 mils a day, and breathing and doing those sort of things can help us clear that away, or taking care of your blood pressure, or taking care of your thyroid, or whatever. So we do need to be aware of risk. How long have I got to go? Who's timing me? 10 minutes. Right. Can I get a 5-minute add-on because of the slides wouldn't work? I'm going to come back to a couple of those and see if I can get those movies to go. Okay, assessing risk is important, you know. For those who don't have lymphedema, sometimes our biggest worry is getting it. But, you know, if you know your risk factors for anything, you can remediate them. You can deal with them. You don't have to be worried about that as a risk factor anymore. So, you know, the most important thing is that, yes, there are a series of risk factors, and you can see some of them here. Some of these here are ones which are beyond your control. That is the number of lymph nodes removed and whether you had radiotherapy, whether you had infections and stuff. But other ones are ones which you can modify, you know, and, you know, stress, high levels of non-controlled blood pressure. At-risk limb is used for repetitive actions. You carry heavy loads with the at-risk limb for a long period of time. You know, body weight is a little high, etc., swelling prior to surgery. There are things that you can modify. And when it comes to lymphatic system, you know, it's okay to grab something and pick up something that's heavy, but you don't want to be carrying it all the time. Because why? What happens if I'm carrying something really heavy all the time like this? My muscles are all tight, aren't they? And what happens if all my muscles are tight around my lymphatic vessels? I can't get the fluid into the lymphatics, can I? But the moment I put that across on my other shoulder and just loosen up my muscles, that moment, then fluid is starting to move out. All the waste products from those muscles and all the rest of the cells are starting now to move into my lymphatics. And if I just put my arm up, yes, it'll move out quicker. If I do some of this, it'll move out quicker and overcome the problem. So by all means, you know, carry every load for a few minutes or a few seconds or whatever, but don't carry it continually, okay? Because it's going to cause a problem. And I guess we'll be having a bit of a chat later, and maybe we can come up here and do a screening program like we used to do many times up around the country. We're going to do a screening program in Port Lincoln in a month and a half's time, from what I remember. And that'll be looking at the risk of you developing lymphedema or your lymphedema risk factors and stuff like that. So let's have a look at risk factors which contribute to lymph load. Here they all are. I'm putting them all up at once. Skin quality as a barrier. Have a look at your skin. If it's a bit crisp and crunchy, it's time to do something. Soften it up with the appropriate skin cream. If your blood pressure is a little bit high, go see your GP, see if you can get it reduced a bit, or get rid of the grandkids who are causing you elevated blood pressure. In a nice way. Tell them to go somewhere else. Try and make your blood vessels as strong as they can possibly be. And there's all sorts of things, there's bruises and there's, all those sort of things that can stop the bruising and make your blood vessels a bit stronger. If you've got a cut or an infection, I don't mean this, but I can't do it any other way. It's just not quite the same when you do that finger. If you've got a problem with your cuticle around here and you look at it and it's red, do something, because that might be that 5 mils per day, okay? If you've got an infection down here and it's red, okay, that might be adding the 5 mils per day. That can make a difference. With the lymphatic system, little things make a big difference because we're only dealing with that amount, 5 mils per day, that can make a difference. So, watch out for infections. Treat them early. Wait, watch it. Fats, long chain in the diet, watch them because long chain fats put a big extra load on the lymphatic system in the tummy area. Middle chain and long chain, short chain fats don't cause that problem. I've done a couple of webinars and podcasts and stuff on the relationship between our diet, between our microbiome in our gut, about inflammatory problems in our gut, our brain, and the rest of our body functioning. And it shows that our diet, optimizing the microbiome in our diet, watching out for fats, watching out for the inflammatory diets versus the anti-inflammatory diets, and all those sort of things can make a difference to the way in which our lymphatic system can work, okay? I'm not a nutritionist, but talk to your nutritionist about diets and that, and you'll be amazed. If you can cut down inflammation, you may reduce the risk of lymphedema becoming a problem for you, okay? Super, super important. Okay, one of the other most important things is to ensure your therapist, your health professional is well informed. Make sure when you're connecting with a health professional that you provide information about your family history. Like, did your mum or your grandmum have swollen arms or swollen legs? Because it might be genetic and you've crossed your legs again. I'm not going to get away with it. Okay, so family history is important because then it's not your fault, it's genetics, okay? And yes, genetics can be dealt with if you're aware that that's a genetic problem. Medical history and surgical history. What's happened in your prior life that might have damaged or led to damage to the lymphatic systems, soft tissue injury, falling off a bike or something like that. I fell off a bike 8 weeks ago and had to have a total knee reconstruction. That would teach me to ride down hills quickly, but anyway, could be worse. But, what you've got to do is tell your therapist or tell your professional who's trying to help you about the whole history. We had one lady once who had lymphedema of her legs, and we couldn't figure out what on earth was going on because we didn't look at the scheme holistically. And then finally, after about the third visit, she said, when I was about 8, I fell off a horse and I damaged my left shoulder. So then everyone started looking at the left shoulder, and what was up here? This is where all the lymph drains out of our whole body, our legs, our tummy, our chest, and all those sort of things. Drains into an area just here, okay? And she fell off a horse and fell off onto a fence, and this is all fibrosed. Do you know what fibrosis is? It's real tough, chewy stuff like you get around chops or a sausage, or no, not in you shouldn't get in sausages. In a piece of steak, that tough, chewy bits, that's fibrosis. And it was here, and it stopped the fluid draining from her legs up here. So that's why you must think holistically when it's coming to the lymphatic system. So while I'm on the holistic plan, and since I've been given 5 extra minutes, do you want to just do this breathing program? Okay, just stand up if you want to. You don't have to. You can stay seated. Now, what you do, we did a clinical trial or 2 on this, and this is really great. And you just stand up, put your hands like this, and what we do is we begin to breathe in deeply. As we breathe in deeply, we open up our arms. Just watch out for the neighbours next door. And as we open up like this, We keep on breathing in, and we move our hands backwards like this until we can feel all of our fingers and arms and stuff feeling tight. Then we hold it 2 seconds, then we begin to breathe out and we bring it in like this, real slow. And then we're breathing out, 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 out. And we bring our arms and fingers back here again. Here we go again. One more in. The lady up the back's doing it too quick. Okay, slowly open, 5 seconds, hold it 2. Back again. Okay, and breathe out. You need to do that ideally 5 times a day according to our clinical trial. You can sit down now. If you don't believe it makes a difference, we can put you on one of our machines and I can show you. You can pull 20 mils or 30 mils or 40 mils sometimes of fluid out of the arm. It's called diaphragmatic breathing. It's similar to what goes on in Tai Chi and Qigong and all those sort of things. And it works. And you probably feel even better now. And you feel better because you've got your lymphatic system working better. So back to this surgical history. Make sure you've given your whole surgical history. Make sure your therapist knows about your current medications because some of them will cause a load on the lymphatic system. And another fellow and I wrote a whole couple of papers on medications which may add load to the lymphatic system. You can actually take these and show your GP, and a slight tweaking of those medications may help the lymphatic system a lot. Okay? That's what's important, that 5 mils per day. Okay? Why is telling everything important? It's going to show also other reasons for the swelling. Okay? If you've got your thyroid, if that's not going so well, you may end up with a swelling called a myxedema. If you've got vascular problems, you may have a phlebodema. If you've got blood pressure, then you may have an edema. If you've got genetic issues, you might have a lipedema or a lipedema, whatever you want to call it. Okay, so each of those may underlie your lymphedema, and if you want a good outcome for your lymphedema, sometimes you've got to get those other things managed first, okay? So it's not the lymphedema therapist whose responsibility that is, but it's your responsibility to tell the therapist about other issues and other problems that you may have. Then you can go and see the right people and get the right team, the right sequencing, the right targeting of the treatments, and that's what's really important to get a best result. But coming back to lymphedema, maybe 3% if you had a couple of lymph nodes removed, maybe 20% if you had all your lymph nodes removed and you had radiotherapy. Okay, there's still 80% who don't get it, but what we want to do is we want to cut down on the severity of the lymphedema of those people who do get it and cut down the incidence of lymphedema in those who are at highest risk by doing things early, by catching things early on, by early intervention, early recognition of the problem, and early reaction to the problem. So the most important thing is that there are lots of things that can be done in the clinic, and you see here our wonderful Monique Barham in the clinic, who's helped us enormously with our lymphedema awareness programs throughout Australia and South Australia. And there are lots of things we can do to actually see what's going on. You and your therapist can actually measure fluids in your arm just by doing a pitting test, just by pushing your thumb in like that and seeing if there's any pitting. If there is, and you've detected it, then maybe go and see your therapist and say, I've got some fluid in my arm, and then maybe that you can get some light compression garment, those sort of things. There's also some fancy ways of doing it, like bioimpedance spectroscopy. You stand on this machine. Some people might have remembered when you come up here in the early days for screening programs. Okay, you stand on this machine, and whammo, it tells you how much fluid there is in your arm, whether you're left-handed or right-handed and all that sort of stuff. Now, the other thing that's interesting, we can measure fibre in the arms or any territory. Just pinch the tissues between the thumb and forefinger like that and see if there's any difference between left and right. If there is, if there's a difference in thickness in this part of the arm or this part of the arm, there may be some lymphatic drainage problems there. Okay, so you yourself can see if there's any problems. When you see some problems, go see a therapist early on. Don't let it get worse and worse and worse. Early treatment, early intervention is important. Now, as with anything, there's all sorts of telehealth apps and available around the world. And there are some good, I don't work for any of these companies or recommend any in particular, but there are some which can help you manage your lymphedema or manage your lymphedema risk by tracking things, seeing how things are going, what's better, what's worse. There's also an online Australian-based program that one of my PhD students has done, And that's all about the way in which, through knowledge, through awareness, through being comfortable with that knowledge and using that knowledge and applying it, you can get a better outcome in terms of your lymphedema, minimising it or controlling it much better than you might have been in the past. Now, the last few slides are going to be about treatment and management areas. And look at them up here. You know, the most important ones are perhaps compression, garments, wraps and bandages and so forth like that. Garments and wraps are part of the SA government subsidy scheme. You're entitled to 2 garments twice per year. Wraps and other things will be coming in soon, we hope, fingers crossed, into that program. But have a look at these other things. So there's lymphatic drainage techniques, there's skin care, activity, exercise, breathing, diet, weight management, water-based programs. So, you know, have a look at most of those, and a lot of them are simple, aren't they? They're easy. You can do them, but you have to be aware of their importance. Next thing, I said earlier, tell information about your lymphedema, about your family history, about your surgical history to your therapist, so we can get these things. This is most important. Targeting and sequencing of your treatment. Okay, it's no good doing massage on a limb where there's lots of fibre. You've got to break up that fibre first. Okay, so the key thing: target and sequence our treatments to get the best outcomes. So just remember, simple things can help our lymphatic system. Breathing, isotonic, isometric muscle movement. Okay, so I'm squeezing my muscles now without moving my arm. Squeeze your muscles without moving your hand. Just squeeze your muscles. Every time you squeeze your muscles like that, that's also helping the lymphatic system. Okay, that's isotonic, isometric movements. So, general movement. Every time I do this, just do this to your hand now. Just go upwards, always upwards. Make sure you've done some breathing before, because otherwise you're pushing fluid up into this area and it's not going to go very far. So that sort of thing is doing the most beautiful things to your lymphatic system, loading it, important. Just remember, empty the buckets. Okay, you can't put water in a bucket. So when you get to a stage where you have to have a garment, don't put your garment on like that. Empty the buckets first. Make sure there's somewhere for the fluid to go when you put compression on. Likewise, when you take off a garment, make sure this part's emptied up here, because otherwise the fluid that's up here will drain back into your arm again. Always empty your buckets before donning or doffing a garment or wrap. Ensure tummy loads are low prior to and during sleep. You know, don't have a big meal within 3 hours of going to bed, because that's going to put a big load on your tummy lymphatics here, okay, and that's going to be harder for the fluids to leave other parts of your body. Surprisingly, even your arms, okay? So watch out for food and stuff. You remember my mum said, eat breakfast like a queen or king now it is, yeah, lunch like a princess, and evening meal like a pauper, okay? Do it, it makes a difference. Okay, breathing, you've seen that, haven't you? Right, all good, that was wonderful. And here's what breathing does. Hey, it's working. Oh, see this. Oh, I'm so happy. You guys done a good job at last. Okay, have a look at this. Look at that movie there. See that? Just do that over your arm. You're doing exactly what you're seeing there. Okay? Move your muscles like that. You're doing the same thing. You're moving all of that. You're helping the lymphatic system. My last slide, which will take 1 more minute. There's aquatherapy. Jump in the River Murray, but be careful. Okay, watch out for those sort of things, because that does make a difference. Please think very carefully about bras. They are one of the worst things that can influence lymphatic drainage, because if you had lymph nodes taken out here, where's the main pathway for your lymphatic? Up around here on the top of the shoulder. Where's your bra strap? Sitting there. So just watch out for your bra. Talk to your therapist about what might be appropriate with those sort of things. So super, super important there. Just remember, lymphatics are low pressure. Okay? Normal lymph flow, just remember, it's not much, is it? Okay? Little changes can make a very, very big difference. And being confident in you being able to make those changes is what's really important. And be confident, because when you're moving like that, when you're breathing, yes, you are moving the lymph into the lymphatics and away from the area. So the key messages are early identification of changes that have occurred in your limb, early intervention, targeted and sequenced treatment. Know that you've got a role, your partner can have a role, or your carer can have a role, you can get independence once you know what to do and how to do it. But please, most of all, think, assess, treat, manage holistically. The lymphatic system has to be managed holistically. So just remember, the most important thing is perhaps this last two sentences here. Have a look at that. Do only one thing different at a time, okay? Then you know what really works. And, you know, if there's a lot of people out there selling things, and try before you buy. Rent before you buy, okay? One thing different at a time. Super, super important. There are lots of good websites around. They are the ones to stick to in terms of information. There's lots of rubbishy websites around and terrible information out there. Stick with the good websites and the good information sites. They can help make a big difference to you. Lastly, is that my end of time? Okay, last of all, just remember, think, act holistically and do it in a partnership. Okay, thank you.